Some say that we are not supposed to have heavy dinner. Mean to say we need to have a light dinner. But some others say that if I eat a light dinner, then I won't get sleep. Then how should be our dinner? Second question is, at what time we are supposed to have our dinner? The food whatever we eat will be having the nutrients, that is the carbohydrate, protein, fat, vitamins as well as minerals. Among them, these carbohydrate, protein and fat are the macronutrients. That means to say we need in some larger quantities. So when we eat some more food, especially in the night time, so it is for the source of, it is for the energy. The carbohydrate, protein, fat, whatever the nutrients we eat will be utilized by our body to produce the energy, and this energy we can make use in activities, our daily activities as well as for working. The food what we eat will be utilized by our body by metabolism. So, but this metabolism, the rate of a metabolism, how it is? So morning daytime, this metabolism will be some more, but as the day advances, after evening, this metabolism keeps on reducing. It means to say metabolism will be more in the daytime and it will be less in the night time. So especially in the afternoon, it will be in a peak. The metabolism, food metabolism will be in peak, and in the midnight, the metabolism gets reduced to very much minimal. So when we eat more food, especially in the night time, and we are unable to use that nutrients for our energy, then what happens? The nutrients, that is the carbohydrate, protein as well as fat composition increases in our blood. So this carbohydrate, first thing is the carbohydrate. When the carbohydrate is more in our blood, then what happens? It's a source of energy. It's the only source of energy. So the body doesn't excrete this extra carbohydrate, but instead it stores this carbohydrate in the form of fat. So more carbohydrate in the night time will not be utilized, will be stored in the body as a fat. So we will become obese. One thing. Second, coming to the protein. So when we eat more protein, especially in the night time, two things will happen. So one is the protein is hard to digest. So when it is not being properly digested, it results in indigestion, abdominal discomfort, abdominal pain as well as the constipation. So more than this, another complication of eating this high protein diet, especially in the night time, is this protein is not a source of energy. So but we are eating a more protein. So this protein has to get excreted. It has entered our blood. It has to get excreted. So the metabolic byproducts will be produced. So what are those metabolic byproducts? Urea, uric acid as well as creatinine. So what are the more protein you are eating is getting converted into urea, uric acid and creatinine. And these things are highly acidic. Our blood is supposed to be alkaline, but when we use more protein, the metabolic byproducts in the blood makes it acidic. So when the blood becomes acidic, we are prone to develop many diseases, especially many chronic diseases like diabetes, hypertension, arthritis, even cancer, liver disease as well as the kidney disease. Not only that, the vascular endothelial cells gets affected, resulting in heart blockages. The blood vessels blockages resulting in heart attack. Third thing, what will be using extra is the fat. Again, when we consume more fat, this fat has to get absorbed into our circulation and utilized. For absorption of this fat, we need bile. We are consuming more fat, so more bile gets produced by our bile. So when there is a more bile, this also causes abdominal discomfort, nausea as well as vomiting. Next, along with that, the more bile is responsible for the stone formation, especially in the gallbladder. Gallstone is one of the cause of this excessive fat consumption, especially in the night time. Then what we are supposed to do? How should be our dinner? So first thing is our meals should be having more carbohydrate. So remember, more carbohydrate and more fiber. You may ask you, sir, more carbohydrate causes more fat, but this more fat can be utilized next daytime. You can work hard and you can make use of this fat. So your night meal should be more carbohydrate diet and more fiber diet, but protein and fat has to be reduced as minimum as possible. Even if you can make it a zero also, protein and no fat diet in the night time. So coming to this carbohydrate, instead of having the starchy carbohydrate of grains like rice, ragi, roti, those will be having a carbohydrate which is starchy. Again, it is unhealthy. Instead of that, you can go for healthy carbohydrate, that is a non-starchy carbohydrate, which we will get in the fruits. So have more fruits. Fruits is nothing but the glucose and the fructose. Again, it's a carbohydrate, but it's a healthy carbohydrate, and you want to gain your weight with the fruits. Next, more fiber we need. For that, you can add more vegetables. We get more fiber from the vegetables. Have more vegetables, so more fruits and more vegetables. So next thing is, how much should be the gap? At least 4 hours between meals and sleep. There should be at least 4 hours of a gap. For the carbohydrate, protein and fat has to be utilized. Whatever we consume in the food, we need a 4 hours a gap. So again, that 4 hours, many people think that at least half an hour walking we do and then come home and sit and keep watching television or watching your mobile. That should not be there. What you are supposed to do, that 4 hours you have to utilize it by physical activities. You need to be active in that 4 hours of gap. How to balance that 4 hours? For example, if you sleep at 11 o'clock, then you need to have your meals, that is the dinner, at around 7 p.m. If you sleep at 10 o'clock, it should be your meal should be at 6 p.m. And even if early, if you are going to sleep at 9, then you're supposed to have your dinner at 5 o'clock. Some people think that if they don't have food in the night, or if they have less food in the night, they start feeling tired. So, but this is a false information, wrong information. So, because for what we need food, it is for energy. Energy for the purpose of work or to stay active. But night time you will be sleepy. So when you sleep, neither you are physically active nor doing any work. So actually speaking, we don't need food in the night time. So feeling a tiredness without food in the night time, it's a psychological addiction, not physical. It's just psychological addiction. So next, some say that if I don't have food in the night time or less food in the night time, don't feel sleepy, that I don't get sleep at all. Again, this is a psychological. How food affect your sleep? So definitely it affects your sleep. How? You start thinking about food, not because of the absence of food. The lack of sleep is not because of the absence of food, but you keep thinking about the food. When you keep thinking about the food, certain hormones get produced within our body, which keep you awake. So lack of sleep is not because of the absence of food, but thinking about the food. Stop thinking about the food because there is no need of food at the night time. Stop thinking about the food. For some people, having their dinner early, that is in the evening, becomes impossible because they may reach home at the night. So such people, how they can balance it? They can balance by avoiding. They can have the dinner at 9 or 10 or 11 o'clock also, but if they have late night dinner, they must skip their breakfast. This will definitely help to balance your nutrition. Next, even some patients, they say that, sir, I'm taking medications, and if I skip my meals, then how can I take my medications? So I have food only because of the medicines. How to balance it? For such people, my advice is something you can have early meals. That is at 6 o'clock or 7 o'clock, you can have your dinner. Along with the dinner, you can have your tablet, or otherwise, you can skip your dinner and you can skip your medicines also. If you are a diabetic, if you skip your dinner, definitely you can skip your diabetes medications. So more than physical need, more than need of our body, we start eating with compulsion. Morning breakfast we need to eat, afternoon lunch we need to eat, night dinner we are not supposed to miss. This is a misconception. You need to come out of this misconception. So you need to eat when our body requires the food. So come out of this compulsion. Be happy, stay healthy. Namaste.